If you're over 60 and your knees feel like rusty hinges every time you stand up, if you've started avoiding stairs, skipping walks with friends, or worrying you'll end up in a wheelchair, what I'm about to share could change everything. There's one exercise, takes just 90 seconds, that thousands of seniors are using to rebuild their knees from the inside out. And the reason your doctor probably hasn't told you about it? It's too simple. There's no prescription to write, no surgery to schedule, no profit in it. But in the next 8 minutes, I'm going to show you exactly how to do it, why it works, and what you can expect in the first 2 weeks. Stay with me. Your knees are about to thank you. You wake up in the morning, and for the first few steps, your knees are stiff, almost locked. You shuffle to the bathroom like you've aged 20 years overnight. By afternoon, there's that clicking sound, maybe a dull ache that never quite goes away. And stairs? Forget it. Going down is worse than going up. You grip that railing like your life depends on it. You've stopped doing things you love, hiking, dancing, playing with your grandkids on the floor, because you're scared. Scared you'll twist something. Scared the pain will get worse. Scared that this is just how it is now. Maybe you've tried glucosamine, those injections, physical therapy that made it worse. Your doctor said, "It's just arthritis," and sent you home with pain pills and a shrug. And here's the worst part. You're starting to believe this is permanent, that your active life is behind you. But what if I told you that belief is exactly what's keeping you stuck? Here's what's really happening inside your knee. And understanding this changes everything. Yes, after 60, the cartilage in your knees shows wear. That's real. But here's what your doctor probably didn't explain. Your knee pain isn't just about worn cartilage. It's about the muscles around your knee that have gotten weak. Specifically, there's a muscle called the VMO, the vastus medialis obliquus, right above your kneecap. When this muscle is strong, it acts like a natural knee brace. It keeps your kneecap tracking properly. It absorbs shock. It protects that worn cartilage. But when it's weak, every step you take puts 3 to 4 times your body weight directly on that damaged cartilage. Every beat, single step. A landmark study published in the Journal of Orthopedic and Sports Physical Therapy followed 365 adults over 60 with chronic knee pain. They discovered that one specific type of strengthening exercise reduced pain by 43% in just 8 weeks. Not surgery, not injections. Dr. Kelly Starrett, one of the world's leading mobility experts, who's worked with everyone from Olympic athletes to seniors, puts it this way. The solution to joint pain isn't rest, it's intelligent movement. When you strengthen the right muscles, you're creating a protective shield around your joints that works 24 hours a day. That's what we're about to do. Build your natural knee brace. All right, here it is. The exercise is called the terminal knee extension. Sounds fancy. It's not. It's beautifully simple. And before you worry, you don't need to get on the floor. You don't need special equipment. Just a resistance band or even a belt and something sturdy to anchor it to. Okay? Step 1, the setup. Take your resistance band and loop it around something sturdy at about knee height. A door handle works great, a stair railing, even a heavy table leg. Now step into the loop so the band sits behind your knee, the knee that hurts. If both hurt, we'll do one side at a time. Step backward until you feel light tension, not pulling hard, just gentle resistance. Think of it like a rubber band, barely stretched. Feet hip-width apart. You can hold on to a chair for balance. There's zero shame in using support. This is about healing, not proving anything. Now, step 2, the movement. Start with your knee slightly bent. about 20 degrees, like you're just beginning to sit down. Now here's the magic part. Slowly, and I mean slowly, straighten that knee against the band's resistance. As you straighten it, push through your heel. And here's the key. Squeeze that muscle right above your kneecap. You should feel it working, not pain, muscle engagement, like you're flexing it on purpose. Hold that straight position for 5 full seconds. You should feel a gentle burn in that muscle above your kneecap. That's good. That's healing. Now, slowly bend back to the starting position. Control it. Don't let the band snap your knee back. That's 1 rep. Straighten, squeeze, hold 5 seconds, return. Straighten, squeeze, hold, return. Step 3, the prescription. And yes, I'm calling it that because this is medicine. Here's your prescription. 3 sets of 15 repetitions. Do this twice a day, morning and evening. Total time, about 8 minutes a day. That's it, 8 minutes. Less time than scrolling Facebook. But this 8 minutes could give you your life back. Critical form tips. Now, 3 things that will make or break your results. Tip number 1, straighten fully, but don't lock or hyperextend. You should feel muscle work, not joint strain. Tip number 2, quality over speed. Each rep should take about 5 seconds to straighten, 5 to return. This isn't a race, slow and controlled wins. Tip number 3, start light. Use minimal resistance. You can always add more tension next week, but if you go too heavy too soon, you'll be too sore to continue. And consistency beats intensity every single time. And listen to your body. Muscle fatigue is good, a gentle burn is good. Sharp knee pain means stop and reduce the resistance. Don't have a band? No problem. You can do this without resistance for the first week. The movement alone helps. Can't stand comfortably? Sit in a sturdy chair and extend your leg. Works just as well. 15 reps too many? Start with 8. Build up over a week. The goal isn't perfection. The goal is consistency. Now, let me tell you why this simple exercise is so powerful. When your VMO is strong, it does 3 critical jobs. Job number 1, patellar tracking. It keeps your kneecap centered in its groove. When it's weak, your kneecap slides off track with every step, grinding against cartilage, causing pain. Job number 2, shock absorption. A strong VMO reduces impact forces on your knee by up to 35%. That's research from the University of Delaware's biomechanics lab. It's like adding a natural cushion around your joint. Job number 3, inflammation control. Here's something fascinating. A 2024 study in the Journal of Aging and Physical Activity found that targeted muscle strengthening actually reduced inflammatory markers in the knee joint fluid. Stronger muscles mean less inflammation. Less inflammation means less pain. It's a beautiful cycle. Dr. Stuart McGill, professor of spine biomechanics and one of the world's top musculoskeletal experts, has said, "The right exercise is better than any drug for chronic joint pain, but it has to be the right exercise, targeting the right muscle with the right technique. This is that right exercise." Okay, let's talk real expectations, because I want you to know what's normal. Week 1 to 2, the foundation. The first 2 weeks, you're waking up that muscle. It's learning to fire again. You might not feel dramatic relief yet, but pay attention. You should notice the muscle getting easier to activate. Many people report 10 to 15% less morning stiffness. Week 3 to 4, the turning point. This is where it clicks. Stairs get easier. You catch yourself walking without thinking about your knees. Research shows an average pain reduction of 25 to 30% by week 4. Week 6 to 8, real relief. By 8 weeks, if you've been consistent, and consistency is everything, studies show that 43% average pain reduction I mentioned earlier. People start returning to activities they'd given up. After 3 months, long-term protection. You're not just managing pain anymore, you're preventing further deterioration. Your knee is actually more protected than it was at 50 because that muscle is now stronger than it's been in decades. Now, important note, if you're not seeing any improvement after 4 weeks, see a physical therapist. You might need form correction, or there could be something else going on that needs professional eyes. But for most people, this exercise is the turning point. Before we finish, let me give you 3 bonus strategies that will speed up your results. Bonus number 1, the timing trick. Do this exercise 30 to 45 minutes before your knee typically hurts most. For most people, that's before their morning walk or before stairs. You're pre-activating that protective muscle right when you need it. Bonus number 2, ice before, not just after. This surprises people. Research from the American College of Sports Medicine shows that icing your knee for 10 minutes before exercise can reduce pain during the exercise by 40%. It lets you work the muscle more effectively. Ice after is good, ice before is better. Bonus number 3, the walking fix. When you walk, consciously push off from your toes, not your heels. This activates your VMO with every step, turning your daily walk into therapy. A study from the Gait and Posture Journal found this simple change reduced knee loading by 15%. And here's one more. Sleep with a pillow under your knees. Keeps them slightly bent overnight, prevents morning stiffness. Game changer for that first hour after waking.